Hello, and welcome to my internship experience. My name is Shakara Jordan, and this semester I had the opportunity to be a public health intern at Premier Pain Solutions in Wilmington, North Carolina. My concentration is community health education. This PowerPoint is broken up into two sections. The first section is on the agency, and the second section is on the internship. So you might ask, what is Premier Pain Solutions? Well, Premier Pain Solutions is an advanced specialty pain clinic with expertise in comprehensive management of chronic and debilitating pain. Premier offers many outpatient treatments that day in the office, such as a trigger point injection, an epidural injection, radiofrequency ablations, all which can range from 15 to 20 minutes. Some more extensive procedures can consist of a spinal cord stimulator trial or a kyphoplasties, which range from about 45 minutes to an hour. These are all done in office with observation of the doctor. The doctor in office can also offer and manage the distribution of prescriptions. The Wilmington office is broken up into two sections. The first section is the clinic, which I dealt with most, which was my hands-on dealing with the community. And the other side, which is about two offices down, is the administrative side. That is where I worked with my capstone project along with many public health initiatives. So at Premier, their mission is that we believe that our compassionate and specialized care will provide you with a beneficial and rewarding experience so that you may finally wake up to a pain-free day. This I saw firsthand was when a patient had been coming in day after day in a wheelchair. He came in for a kyphoplasties procedure where they insert the balloon into the vertebrae and the cement then takes place out of the balloon and fills the spot where the vertebrae was, so then there can be no further pain in the future. Comes back a week later, he had been wheelchair bound for years due to a spinal cord cancer and many other health and debilitating problems. Came back a week later and he was out of his wheelchair and walking. He felt amazing, and that's when I really understood that they do wake up and feel pain-free. Premier Pain Solutions is a private for-profit corporation funded by Owner's Equity. Their goal at Premier is to provide life-changing care, intelligent and comprehensive pain services through advanced, minimally invasive treatments, offering patients a life free of pain and addictive medications. These minimally invasive treatments are all based on what kind of procedure you get. Most of them are just injections, you're in, you're out, nothing too extent. Even with the procedures that take 45 minutes to an hour, you're going to wake on up and there's not much recovery other than just going home and relaxing at that point. The doctor, you're going to come in so much pain, but the doctor's going to make sure you leave that day feeling pain-free. And if he ever does write you a prescription, he doesn't want you to become addicted to it. And if he does see a sign of something going on, he's going to change that. So within the offices, there's the two in Wilmington. So on the clinic side, there is an MD, Dr. Christopher Mallard, an ANP, an adult nurse practitioner, Kathy Lewis, 4 medical assistants along with a site supervisor, 2 front desk receptionists, and that's where I came into play when one of the front desk receptionists ended up leaving, and I took that spot really for the time being. And then on the other side, which is the Wilmington Administrative Office, which is where I would do a lot of public health work and my capstone project, that is where the healthcare administrator, HR, 2 referral coordinators who work hand in hand with many offices around the area and around North and South Carolina to get patients to come in. There's the medical records and insurance authorizations. 3 schedulers who call, schedule, make appointments for people, and then the billing office. So between North and South Carolina, there are 6 locations. The newest location was just opened in Pinehurst, North Carolina, and that is where my internship project was in accordance with. The other one in North Carolina is in Asheville, and that is where the Dr. Baksh, the owner, is home based at, but he does travel around to all of them. In South Carolina, there is a location in Greenwood, Easley, and Columbus. So the next part is about my internship experience and what I was doing. So from a day-to-day schedule, the door did stay locked at all times due to COVID restrictions, so I would come to the door and conduct a 5-minute COVID screen. That consisted of getting a name, date of birth, taking temperature, and asking questions such as, have you traveled outside North Carolina in the past 2 weeks? Temperature 99 or higher? Abnormal cough, shortness of breath? Have you been exposed or tested in the past 2 weeks? If everything was good to go, they could come on in and I would assist them from there, whether that's filling out paperwork or just taking a seat. I would also collect copays, account balances, talk with patients just like I'm doing right now over at Doxy, which is where they would come in and just talk with the doctor, but on the computer, and make phone appointments. We would also process forms such as HIPAA forms, pain management contracts, and financial policies and insurance authorizations. These forms maybe I had to go through and talk with patients about because some of them didn't understand what they were signing really. And I would also work in coordinates with referral coordinators, making a spreadsheet and working with different offices around the area to get some new patients on. And I would also call and schedule, reschedule, and make appointments for people. So projects accomplished. First one was my capstone project, is where I used my knowledge of designing and implementing a program and made a nutrition-based program called Health as well. This was because working in office can cause a really unhealthy lifestyle of reaching for that Coke, that bag of chips, but I wanted to change that within a 30-day time frame of introducing people to drinking 8 bottles of water a day and bringing in healthy snacks, healthy alternatives. But along with this, it was a competition in 30 days. Whoever drank the most water at the end of the program did win. In my internship project, it was a constructed series of evidence-based materials. These were sent off to Pinehurst, North Carolina to the new office, and these materials were made as a way for the provider to talk with the patients about why they're being sent to pain management, exactly what is pain management and how can they help them, rather than they're not there to take away their meds. And then lastly, PBH initiatives I conducted were some COVID-19 public health initiatives. These were sent out to all the offices and were used as a way to just inform people of knowing their 3 W's and when to know if they should come to the office or not really. So these were some examples of what I would work through. On the left is some examples of my capstone project. I have the calendar up top of where people would mark when they would complete a bottle, has their initials. The bottom left is my first newsletter that I did, and also a pre-test I sent out. On the right is two of my internship project samples. These were just ways for the provider and specialists to stay informed in how they can keep their patients informed as to why they can't write them so much medicine, what is pain management, and why are you there? So these next slides are some of the COVID-19 initiatives I did. We have our Know Our COVID-19 Symptoms and our Know Your 3 W's, wash, wear, and wait. These were sent out to all the offices, along with these two, myths versus facts, and 5 steps to prevent COVID-19. So my internship covered many CEPH and PBH domains. Some of those consisted of roles and importance of data, not too much, but I did touch on it, identifying and addressing population health challenges, along with human health, determinants of health, a review of the health systems. I would really look into the insurance, understand what exactly the insurance covers, if it's authorizing such things, health policy, complying with policy like HIPAA regulations, ethics and economics, along with health communication. Never been in a situation like working in the healthcare where I had to deal with these type population and even knowing how to communicate with them. So I did learn that. Covered about 11 in-check competencies, ranging from defining the population, extracting data from databases, training personnel. I did get the opportunity to train someone to take the spot I did take or leave, along with I developed materials and implemented a plan, complying with HIPAA regulations, delivering messages using media such as I would send out company surveys and appointment reminders, that such thing, through an app called Podium, texting app. So what I would say was the most important thing learned during this internship was learning how to deal with the priority population. Chronic pain population is a very tough population to deal with. People are on opioids, though they might have a past of drug abuse. They're hurting and they just need help. What I liked the most about my organization was the staff was very friendly and helpful and a great supervisor. What I liked the least was communication and organization. I'm a very type A person, and when things aren't going the way they should be, it really does get under my skin. Most memorable thing was actually I passed out during the first about 2 weeks on the site. I was actually in a room with a patient, kind of crazy. And along with my second memorable thing was having a surprise birthday party and a going away party my last week on the job. And the most important thing I would say I learned was being able to take my knowledge of what I learned in public health of designing, implementing, and evaluating a program and actually incorporating what I had learned in the past into my actual program for my capstone project. And this was my going away cake and a card that everyone had signed for me between both the offices. And that's all. Thank you.